Hi, I'm Dipesh Patel. I'm an emergency physician in Los Angeles, California, with advanced training from the London School of Hygiene and Tropical Medicine. I'd like to share some information about COVID-19. I'm making this video because I think there's a lot of misinformation that is contributing to the spread of the virus. I want to protect my family, my friends, and communities. So I want to highlight some facts. You might feel helpless being at home, but please realize you are actively helping prevent the spread of COVID-19 and saving lives by staying home. COVID-19 stands for Coronavirus Disease 2019 and is caused by SARS-CoV-2 virus. There are many human coronaviruses. In fact, if you've had a common cold, it likely was a coronavirus. And up until recently, we've known about 6. This one has never been seen in humans before, and so it's a novel coronavirus. This one is deadly because of how infectious it is and how many people it's capable of killing. COVID-19 spreads via respiratory droplets, which are microscopic particles from coughing and sneezing. These are also present if you're blowing your nose or spitting. Coughing and sneezing in general sends droplets a couple of feet away, thus the recommendation to maintain about 6 feet of distance between yourselves and others, and essentially eliminating that possibility of respiratory spread. Unlike many other viruses, this coronavirus can live outside of the human body for hours and possibly even a couple of days. And that's likely contributing to one of the most common ways in which this is possibly spreading, otherwise known as indirect contact. What do I mean by indirect contact? Well, let's say I have COVID-19 and I cough on a surface or an object. Now you come by hours later, maybe even a couple of days later, and you touch that surface or contaminated object. And without washing your hands, you bring your hands up to your mouth, your nose, or your eyes. By doing so, you've now contracted the virus and are probably going to be infected. Let's talk about the epidemiology, which has to do with the spread and control of COVID-19. What started as a handful of infections in a place far away is now responsible for the United States having the 3rd highest number of cases in the world. Each infected person spreads up to 2 to 4 new people, and this is responsible for the exponential rise in cases we're seeing. Now, compared to the influenza virus, or flu, this kills up to 40 times more people. We can drastically decrease the spread, however, with 2 key measures. 1, staying at home and staying in place, and 2, infection control. If you remember nothing else from this video, please remember this. Let's talk about the first of these, staying home and social distancing. These measures are trying to do something we call flatten the curve. This refers to spreading out the number of infections over a long period of time so that the healthcare system has the capacity to treat those severely affected. I'm going to show you a mathematical model that uses projections to demonstrate just how impactful this is.
Model is endorsed by research experts and health department commissioners and is designed to help us understand the outcomes of different social behavior modifications. You can look this up for your state at covidactnow.org. I'm going to use California as an example. When you look at this graph, this black line here represents the health system capacity of California's hospitals. Without any behavior modification whatsoever, you can see that in as little as 1 to 2 weeks, the number of hospitalizations we can expect from COVID-19 estimates at about 74,000, which is double the number of available beds in California. If we perform only social distancing for 3 months, you'll see that for the next couple of weeks, the healthcare system will be able to manage the number of hospitalizations caused by this virus, but that the number of new hospitalizations in the weeks thereafter will very easily exceed the hospital system's capacity. The point of flattening the curve is to take these number of infections and by aggressively instituting behavior modifications such as sheltering in place, we can now spread out the number of infections over a much longer period of time, in this case about 18 months, so that the healthcare system can take care of all those people who need hospitalization.
Unfortunately, some states have passed the point of no return. And whether or not your state is one of these, please act now and change the course for your community. Now onto the second measure, which has to do with infection control. 4 of the best ways to avoid contracting and spreading the virus are 1, frequent and proper hand washing. It doesn't matter whether you use an alcohol-based sanitizer or soap, the key is to use proper technique and to wash for a minimum of 20 seconds. I'll put in a link below so that you can see how to do both of these and the importance of them in a separate video. 2. Avoid touching your face. It's really hard to do, but it really minimizes the spread via indirect contact. 3. Clean and disinfect any contaminated surfaces. And 4, probably the most important of them, if you are sick, please stay at home and call your doctor for more guidance. So, how do you know if you have symptoms of COVID-19? Well, we're used to hearing of 3 classic symptoms: fever, cough, and shortness of breath. In reality, I've seen patients in the ER who've tested positive for COVID-19 with symptoms of sore throats, runny nose, body aches, nausea, vomiting, and even diarrhea. 80% of COVID-19 patients only have these mild symptoms, and if that's you, don't write them off because you are still highly contagious. You may even be contagious to others if you don't have any symptoms, and there are now reports coming out of other countries that symptoms as simple as a sudden onset of a lack of smell or a taste without any other symptoms may suggest you are infected with COVID-19. Of course, many other conditions could lead to these symptoms, but the point is, it's much better to be overcautious and aggressively self-quarantine than to be undercautious and be a part of worsening this pandemic. Look, there really is no specific therapy for this disease. There are some theories about what could work, but there isn't any definitive evidence. Please don't hold supplies based on hearsay from the internet. If you're watching this video, chances are you're probably not sick enough to require these medications anyway. The people who may need these are your dad, your aunt, grandparent, or elderly neighbor whose lives may depend on these if they're proven to show benefit. Overall, the best treatment really is avoiding getting the disease in the first place, and if you do, to avoid spreading it to others. To wrap things up, I have one big ask of you. Please, please, please donate any unused medical grade masks you may have to your nearest hospital. We need them, and we don't have any more. We cannot take care of you or your loved ones without them. Research shows masks are not nearly as useful to the healthy person as they are to healthcare workers who are treating and preventing the spread of this infection. So please spread the word and help us help you. Thank you for watching this video. Be calm, be safe, take care of yourselves and the people around you. Thank you.